So this is exciting. This is the time where you can start entering all your information into AMCAS. So we're going to be covering pretty much everything at a high level and then some key components. So we're going to do quick introductions and then we're going to go do an overview of the application cycle components. And then we're going to talk about what does a competitive applicant look like. We're then going to spend most of our time breaking down the AMCAS into key sections with examples. And so we have screenshots of some applications that we've given before, or that we've seen before from some of our students. And so we have a couple screenshots on there. We're going to talk a little bit about secondaries, although this will not be focused on secondaries. And then we will have 10 minutes or so, 15 for Q&A. So what we wanted to say though is feel free to ask questions during, I know some of you have your laptops open, some of you online might have your laptops open, might have your application. So feel free to ask questions during, but if there's something that you feel can wait to the end, feel free to do that as well. So we've slotted a lot of time for all of that. So my name is Jade Frame. I am one of the associate directors for career development and industry engagement. I specifically focus on pre-health pre-med students. And so a lot of what we do is programming, meeting with students one-on-one, presentations like this. We also help students with their applications one-on-one. So we do a lot of different things. We have a lot of connections on campus, for example, to the School of Medicine, to the PA program, et cetera. A little bit of background. I was a UC undergrad, got my bachelor's in neuroscience, went back to school, got my master's in counseling with a specialization in college counseling and student services. So that's where I'm at now. And I've been here at UCSD for about 3 years or so, 3.5 years almost. So I'll hand it over to Ron really quick to introduce himself as well.
I do the camera. Recording is fine. Alright, so Andrea's been at UC over 6 years now with the Career Center, a little bit longer than Jade, almost 4. And then as far as a little bit of background, I'm also Associate Director for HealthGate alongside Jade, so ours is pre-health. Before before this role, I had worked in healthcare education for a pretty good amount of time as a program manager for the post-baccalaureate programs. Before that, I worked at a nursing school for about 6 years. Before that, I did general admissions for all programs at another institution for another 6. So I'm really excited to go over this since for a lot of what I've done is a lot of admissions review. And I think it's very helpful that people have a chance to kind of ask questions, understand the logic as you're filling out the applications, because it's a very important thing to work on. And then as far as some context, my biggest thing is just making sure that when we're filling it out that we think about, okay, how do we want to communicate ourselves, because the reviewer has a very limited bandwidth and amount of time to get through all the applications they're reviewing. So we'll focus on that as part of the strategy today. And then I'm going to go back to the chat.
Cool. So if you don't know, this is our website. We have some general information on here for all pre-health career, or most pre-health careers. So feel free to scan that QR code. And so go ahead and actually, so I'm going to ask you to scan this one specifically, just because, and Ron, if you want to put that in the chat for the folks on Zoom, because this is the application guide. We will be referencing some of this. If you have any questions of things that are not on the slides, we'll be referencing that. But it's, everything you need to know for the application cycle if you haven't seen it already. So a few more seconds for y'all to scan that. Cool. All right. So the application cycle components, I would like to break them down. I like to kind of break them down into quantitative and qualitative. Okay. So you have the quantitative transcripts, academic history, MCAT scores, right? And then you have the qualitative, which does make a really big chunk of your application. You have your primary application, which includes your personal statement, your experiences, your letters of recommendation, and we're going to touch on all of these. We're going to touch a little bit on the secondary application, which is separate from AMCAS. These are short essays, 2 to 4 questions about per school. So you're writing a lot of mini essays. We'll also talk about how many schools you might want to apply to, maybe how to select your schools, things like that. So just also an overview. I like to start with overviews just so we can get some context, right? So application has opened today. It's May 1st. I can't believe it's May already, can you? It's great. I mean, spring is here, the swallows are flying around, it's really beautiful. So application opens, you will have about a month before submission. You do not necessarily need to submit right at June. I wouldn't go past the end of June, maybe July, if you can. I get a lot of questions, oh, can I wait till September or October? You can, but it's rolling admissions and your chances decrease the longer you wait. But I would say, there's no need to rush if it's not ready right when it opens, I think May 27th or 28th at the end of this month, right? But I would say give it no more than 2 or 3 weeks is probably a competitive timeline. After that, it gets moderate and then you're not really competitive once you hit August and September and October, okay? And if you have specific questions, feel free to ask that. We can answer any like outlier questions. Interview or secondaries are from July through September. They take about 2 weeks before they send out those secondaries back to you. Those are the mini essays we talked about. Then you have interviews, which kind of takes up the largest span. You will be offered interviews probably in the fall all the way through February. And I've seen it as late as March personally, but February is kind of usually when we see most of them. Then you have acceptances between March and May, so you'll start getting those back, and then you have decision day on April 30th. So hopefully if you do get acceptances like later in May, it may just be like they might give you like a timeline to accept that. And then you have starting medical school between July and September, depending on the cycle. So hopefully this gives you a good overview from here on out. Any questions? Cool. So how would I define a competitive applicant? So I'll ask you all, like, what does a competitive applicant look like to you?
High GPA, high AMCAS score, at least 1 or 2 labs on campus.
Okay.
Volunteer more than 200 hours volunteer hospital.
Got it.
Yeah, a lot of patient care experience.
Patient care experience for sure. Do you want to close the doors? Yeah, just because the mic is, thank you so much. Yeah, so you've mentioned research hub. Anyone else want to add to that? Yes.
I would say like I talk about like patient experience, like meaningful patient experience that you can talk about.
I like that, differentiator, meaningful patient experience. And we're gonna cover all of that too. Did you want to add anything else, or that kind of covers everything?
I guess sort of like a theme to your application, like what are you interested in?
That's another keyword, a theme to the application. So, I do want to say, I know, what was your name?
Michael.
Michael, so I know Michael mentioned metrics, GPA, MCAS score. Believe it or not, there is, like, for example, UCSD School of Medicine, when they're reviewing their application, they actually blindly review your application without looking at your GPA and your MCAS score. They look at that at the end. So they have already decided in their mind, do I like this person or not? So I'm not saying metrics don't matter, but I think students put more emphasis on them than the reality of it. So I think it's gonna come down to being a strong applicant in the areas of core competencies. So I want this to kind of be one of your foundations to your application, making sure that all of your experiences matter. You have all of the core competencies met, and you're making sure that they're meaningful, right? So the experiences were meaningful to you. They have kind of a common thread that connects them to a theme. And we're gonna talk about mission statement as well. A little bit, that's gonna be kind of your the other half of your foundation, your mission statements will be very important. But all of this should be displayed in your experiences and in your personal statement. Not one of them should be missing, okay? So there's 17 core competencies. And so when they're reviewing your application, they actually have this criteria up, some of them, and they're kind of checking, making sure that you've met all of these. So, any questions so far before we're gonna start getting into kind of each section in order, not all the sections, but we're gonna touch on kind of like the top 7 sections that we get the most questions on. And feel free, like I said, ask questions in the chat, and y'all in person can ask questions as well. But I just really wanted to get this point, because I think a lot of students they kind of approach, especially in our one-on-ones, they approach us and they're like, oh, I have this, this, and this, I have this experience checked off, I have this GPA, and I'm like, okay, why do you want to be a doctor? And they don't have an answer, like a concise answer. Okay, and so really think about what your concise answer is, and we'll cover mission statement a little bit later too, to talk about what that looks like. So while we're, going through this, think about that. Okay, so the first section we're gonna talk about on AMCAS is identifying schools, identifying info in schools attended, so it's just basic personal information. I would say this is a pretty straightforward section for the most part. Any post-secondary institutions attended, including community colleges, international schools, UCSD, right, so just make sure you're listing all of that, ensuring consistency with transcripts, oops. And then, so just making sure that everything is accurate, right? And then biographical information. The schools do their own checks on their end, but you just wanna do everything to your ability of like, trueness, because you don't wanna delay your application, so just do everything to the best of your ability. So we don't have a ton on that, because that's pretty straightforward. The next one is coursework. You manually actually enter every single course that you've taken after high school, so that's quite a few courses, right? If you're to count it up, it's like, I don't know, 4 times 3 times 4, whatever that is, I'm not great at that. So we'll say 50 courses at least. So, if you have taken dual enrollment in high school, for example, you will need to enter those as well. AP coursework that you've gotten credit for here on the transcripts. Ron, do you know if they have to enter AP coursework?
Ideally, if you are gonna enter anything, it should be that your transcript reflects the associated course. And then the AMC usually recommends that is put part of your freshman year. So they say anything that's coming in around the same time you start your education, you just put it all under your freshman year, and then they'll have notes on how do you status that in the AMCAS guide, depending on how it shows up on your transcript when applying.
Yeah, and if you took AP credit and you didn't get credit for, or you took an AP course, took the test, you didn't like your score and didn't get credit for it, you don't need to enter that, right? So it's really the things that you've gotten credit for here at UCSD. You will enter repeated courses and withdrawals as well. So transcripts and course classification, you will have basically visible transcripts and or digital transcripts. This is just some basic information. The visible transcripts are mailed the same day and ordered by 1:30 during business days. Give it 2 to 3 weeks for mail-free paper transcripts. And overnight cost extra. So this is gonna take longer. Digital transcripts will be instant, so whichever works for you. And if you have any questions, just call registrar, okay? Don't call us because we won't know all the answers, call registrar. And then when you label your coursework in AMCAS, it will be BCPM and all other. This link, I don't know, Ron, if you want to put the link in the chat for them, and we'll also send this these slides out, but you can kind of look the classifications of the courses. Okay, so here's an example of actually one of our students who is currently here at UCSD School of Medicine. This is an example of what your GPA looks like. So it will break it down with BCPM, all other, and then your total GPA. Don't worry about hours, you're not calculating that, they calculate that. So whether you're on a semester or a quarter system, don't worry about that, they will do that. Cool. All right, so working activities. This is gonna be a big chunk of your application as well, because you can enter up to 15 experiences, clinical, volunteering, research, etc. Any military service, or I'm trying to think, because there's like at least 20 different categories under experiences. So you just have to choose the ones that match your experience most. You will mark up to 3 as most meaningful, and you have a 1325 character limit. So 1,325 characters, in addition to the 700 characters. Okay, so you have kind of like one paragraph and then a longer paragraph. And so we'll show you an example of what that looks like. You want to just make sure you're clear and concise, because this is really impactful to your application. They're reading these top meaningful and they're like, these are kind of the biggest building blocks of your theme of your application. So you want to select very carefully what that's going to look like. So clear, concise, action verbs, just make sure like also you're not over explaining anything, because believe it or not, when you start typing, you're really trying to get the point home. It's hard to do that in like 2 paragraphs. And so just make sure you're whittling that down as much as you can. So, like I said, this is kind of what it looks like, and I'll give you another example, so don't worry, because it's pretty small. But this is what it looks like when you're in, experience details, type of recognition, like what was it, average weekly hours, et cetera. So you want to break all of that up. And you can see that right now in your, if you go and look at your application. ACOMA, so for DO schools, you do have unlimited experiences, activities, and awards. However, you do not have top 3 meaningful experiences. So just make sure you notate that. They're gonna ask you for general information of it. They're going to ask for experience description, which is about 600 characters. And then highlighted to get additional like word count. Or it's highlighted, do not get additional word count. So just when you're in there, just make sure you're kind of looking at the word count. I would say type on a Word document, highlight and look how many word characters there are. And then you can copy and paste it. And I think actually, Ron, this is ACOMAS, right? This isn't AMCAS.
Yeah, that one is the Comas version, and the one above it is the
And
AMCAS.
this is the AMCAS.
Yeah.
Sorry about that. Okay, so we're not gonna go too much into this, but I would say, you know, for your most meaningful, think about what contributed the most to your growth as a person. One thing I will say, a big tip is for most of your most meaningful, maybe not all 3, but maybe 2 out of the 3 at least, get a letter of recommendation, if you can. So, for example, I had a student who did like clinical volunteering, they did a crisis hotline, and then they did another clinical or research for their top 3. And they didn't get a letter from the hotline just because the way like work was set up, it's hard to like have a direct supervisor. You know, they just didn't get a letter from that person, but the other 2 they did. So think about that when you're thinking about, you know, your letters of recommendation in your top 3. So we talked about finding a common thread. So your experiences tell a story about you and why you're pursuing the field of medicine. So what compels you to pursue your career? Does this experience speak to personal growth? Did you overcome any hardships or challenges? I would say that's a big one. Resilience and adaptability is one of the competencies, and it's amazing when students are able to display that. And then is this, whatever this experience is, did you realize any values, your vision, your mission, or anything from that experience? Because remember, it's all tying back, which we'll get to in a few slides, your mission statement, right? So everything ties back to the foundation of your application, which is your reason for pursuing medicine, or i.e. your mission statement. So what to avoid with the experiences, the sales pitch. So really sounding kind of like robotic, and you're talking about skills but not describing or walking through what the skill actually looks or sound like. So I'll just give you an example. Effective communication ensured compassionate interactions with patients and seamless collaboration with colleagues, ... It's very like robotic, right? And then this person just gave a list of self-prescribed attributes versus telling what they did where they showed empathy. Maybe they worked with the patient and got them additional blankets because they were cold, and it was like a small gesture of kindness. The bad resume is basically writing down what is on your resume. So when you're explaining experiences, I think this is the biggest thing, is making sure, I prefer narratives, or at the very least, making sure your experience touches on a value, a vision, or goal that you've realized for yourself. You have versus like I did X, Y, and Z, right? You just don't want to leave that because that's on your resume. And they can imply that from what you have written, but they don't really know. I told my student, like, I don't see your soul. I want to see your soul when I'm reading, because like all I have is this application. All I have is your GPA, your MCAT, and then words. Like I need to know your soul through these words. And I'm a writer, I like poetry, so I'm a little bit dramatic with it, but I do think that admissions officers, they are looking to see like who you are as a person. And I know that because I've spoken to a few. And then the negative review is the last one to avoid, kind of talking badly about people. If you are going to talk about a challenge, just make sure you spin it in a way where you learn from that challenge and don't back talk about it. So that's pretty much this. Cool. So here's a strong example. I'm actually gonna have one of you read, let me see, there's this one. Let's do this one. So can someone here read the hospital volunteer example? Description and most meaningful? Yes, right.
Description.
Yes.
I've rotated through several departments, including medical, surgical / telemetry.
Mhm.
ICU, birth center, recovery, emergency surgery, behavioral health, and caring for patients that take vitals, help with meals, ambulation, bed baths, telemetry, repositioning, group therapy sessions, and de-escalation. I've also had the privilege of scribing for births and surgical procedures from orthopedic cases to laparoscopic robotic assisted inguinal hernia repairs. I've learned the value of communication skills. I've gotten a close look at how various staff come together as a team and gain varied experiences from having to use restraints as a vehicle to continue care to holding an excised appendix in my hand.
That's pretty like depthy. Is that the word depthy? What word did you use?
I would like to say intense.
Intense, yeah, like depthy or intense, like they were able to get a lot into like 700 characters. And so I'll read the most meaningful. One night I was ambulating a patient determined to take a walk, even as she clutched her walker till her knuckles were white. As I held her gait belt and wheeled her oxygen cylinder, I tried to divert her attention when we had to step to the side to let pass a gurney with a body bag heading into a COVID room. Alas, the diversion didn't quite work. It was certainly tricky when she told me that it's the third she's seen during her prolonged stay, and that's why she especially wanted to go home. In my role, I could sympathize with her and said, I can't imagine what you must be going through. I hope you get to go home tomorrow. But I realized that my momentary conundrum is nothing compared to that of the doctor. The doctor who has to tell her the next morning that she's still not well enough to go home, that she needs the network and support of the hospital. My experiences have painted practicing medicine as a humongous challenge, but one I aspire to rise up to. In my current role, I realize even starting simple with a listening ear and a friendly voice is enough to make a difference for a patient. So this is an example of top 3 meaningful, or one of the top 3 meaningful. What I love the most about this one is they did a lot with little. So remind me your name. Miriam. So Miriam talked about making sure the experiences that you do are actually meaningful. And I would also go as far as say maximizing that experience. So it looks like they have one hospital volunteer role, but they were able somehow, probably through their networking skills, through kind of asking folks questions and really inquiring, they have several different areas that they were able to work in. And this shows a lot of, I would say probably like initiative. In my opinion, if I were to read, I'm like, man, this person has a lot of initiative, and they really took the next step to maximize that experience. And so I'm gonna kind of learn something about this person's character in a bit, or even like in a couple paragraphs, right? So I would say this is a really good example. I don't know that we have time to go through all the examples, but this will be sent out. This is a research assistant. One thing I'll say about this is the reason I like this one specifically is they took research and made it humane. If we were to read this, it talks a lot about, the people involved in the research. And not everyone has clinical research, but I would say if you do have like wet lab research or whatever, think about how it actually impacts the population and what does it mean? What are the implications for human beings, right? Because usually when we're doing research, it's for impactfulness on humans. And so you want to find a way to connect that. And I think this person did a really good job in telling the stories, for example, of the preschoolers that they were that were involved in the research. So that's one example. And then this is another example. I just wanted to show you what it looks like after you enter it and submit it. So this is what it looks like. Sometimes people will do experience description and most meaningful and like kind of, it'll continue from here to here, if that makes sense. So they just split it in 2 and some people kind of separate it out. It doesn't, whatever works best for your narrative. Any questions so far? Does some of y'all have your application pulled up, kind of looking at it, what it looks like? Yeah. So yeah, if you have any clarification questions or something doesn't look, quite right, let us know. I think this is actually you, Ron. I went a little quick. Maybe, is there anything else you want to touch on before we move on to the next sections?
Well, for experiences, I'll just say this much. It does take a bit of time to really finesse it. So what I tell all of my students when we're looking at, these examples and thinking about meaningful experience, I always like to think of it from the perspective of, we technically don't have a lot of room, right? And so we want to avoid or edit out things that we can easily assume, so we can focus on lessons learned, interpersonal relationships. How this better informs us as a person, right? So sometimes I think of what are things that would be helpful from the reviewer's perspective, so like. I wanna know what's the population you work with, I wanna know how does this affect how you operate in the world, or what have you learned from that changes maybe your approach or what you wanna do, or helps you ask those critical questions. Another thing that sometimes that I'll tell students is, walk me through how you got from point A to point B. Not the step by step of I did this, I did this, I did this, but this is what I said, this is what happened that I observed and what that impact was, right? I think a lot of people focus too much on the description of something rather than the impact of what that experience has, or like the real meaning behind what you got out of it.
And just to give you like some more context, I've met with students who have had to apply like 2 or 3 times. And they weren't sure why they didn't get in the first time. And so a lot of people that said, oh, I want to avoid that, so how do you avoid that? And I think a common thread that I see with the people that don't get in versus the people that do get in is the people that don't get in, when I'm reading their experiences, they don't really see who they are. I don't really feel I feel like it's a little bit discombobulated, if that makes sense. It feels like it's like a resume. It doesn't feel like it's a story that they're telling. It feels like they just entered information, and the information pieces that they entered were good. They had good experiences, but I didn't get a sense of, okay, why are you pursuing medicine? What is your mission, your vision, your goals, your values? I didn't really get a sense, or if they did have that, it was really piecemeal, and I had to like really guess a lot. And so I'm like, this isn't clear enough. This fell into the middle majority, right? Even if you have a 3.8, 3.9 GPA, this fell into the middle majority, unfortunately, because there are people that are telling their stories. And so the people that are getting in, they have 3.5, 3.6. I know we showed you a student that has like a 3.8 or 9, but I would say that's kind of an outlier. A lot of students that are getting in have like a 3.6, 3.7. It's not like perfect as far as GPA goes. It's still high, obviously, relatively. But their application is beautifully crafted is usually what I'm seeing. So I do want to put a lot of emphasis on that and take emphasis a little bit more off of the MCAT and the GPA score, okay? All right, Mark, you're up.
Well, can I ask about the MCAT?
Yeah.
So if you get under a 500 on the MCAT, do you just not even try to apply?
Well, and you can add to this, Ron, you can apply to DO schools, and you can still apply to MD schools. But I would recommend retaking the MCAT if you really want to apply to MD schools. And so this is kind of the nuance, right? So I'm saying, oh, MCAT doesn't matter so much, GPA doesn't matter so much, but I do think that the data is kind of skewed on who's getting in, like with just on MCAT and GPA, if their overall application. But I will say 500 or under is pretty low for MD. I would aim for like at least a 508 if you want to stay on the lower end. Yeah. Follow up?
I would say a lot of students try and target above 510,
Yeah.
like 510 and above. That's been kind of like the traditional target for the last couple of years. I do know a lot of students that get below that still get to medical school fine. It's again a combination of, is there enough there that we know that they are going to do well enough, right? For some schools, that threshold is very different, right? I know one school that they say, we really have reservations for below 5.4 because we don't know if we're going to have enough tutoring resources to get them through USMLE 1, right? So some schools might make that a point for themselves, but it's not necessarily universally going to be the same, that they're all looking for the same level of metric on the testing component. There are some schools that are very successful internationally that don't require the MCAT at all, right? And they got, one of them is University of Queensland, who got 100% residency match rate in the US, right? And they didn't require an MCAT.
I think that's a really good point. It's kind of up to the schools to decide they kind of have like a mini committee. They're like, okay, which students are the most successful in our program? So some programs will focus more on GPA. Some programs will focus more on MCAT. Some programs will focus more on certain sections of the MCAT, such as CARS, or they'll focus more on the preview exam and kind of ranges there. So believe it or not, every school kind of has their own flow and what they want. So we try to get like all encompassing general information, but I love like the nuance that you said, where each school is slightly different.
Yeah, you got a question?
Yeah, it's also on like the same lecture, but okay, personally, I got a 503 on the last AMCAS that I took. But during that time, I was going through extenuating circumstances with my family and whatnot. I don't believe I would be able to retake it within the upcoming cycle.
Mhm.
But do you think it would be like an option to justify my score, or do you believe that like it would not be necessary?
It's really more of a matter of and this is something in general with the application. So the application always has a section that is there anything not already included in your application we should be aware of or that you would like to mention, right? So typically, if we had a struggle or a specific period of time in our academic career where we had a lot of things happen, you know. This is it's kind of a reformat of what used to be the COVID question, right? How has the pandemic affected you was the question format, right? This time around or moving forward, is kind of transition back to the more traditional question, is there anything not included that we should be aware of or that you would like to mention, right? That's our opportunity if we feel enough has happened that we want to clue them in on that and it's not going to show up anywhere else on our application, whether personal statement, experiences or anything else. That's our opportunity if we feel like it's necessary. But I'm not going to say do or don't do it because everybody has kind of a different level of comfort with what they can disclose. And then the other thing is sometimes depending on your school list, it might not be as big of a deal, right? So again, you kind of have to balance out those areas because sometimes it's a very personal thing that people aren't yet ready to talk about, and we don't want to necessarily say yes, say it, or don't say it, right? Like it's really like, am I okay and comfortable with talking about it? If I am, do I feel like I can talk about, some additional considerations during this time for these things, which may have made it a little bit more difficult, right? So it's not a yes or no because it never is, but that's how I would think about it. And also bandwidth, right? Do I have the bandwidth to also do that additional work on that additional supplementary question or not? To really talk about that, and I'm also focusing on all these other things, including personal statement, which I'll get into in a bit. Makes sense?
I was thinking of just including the MCAT as an activity in the activity section. It's like if it's a low score, it'd be like, oh, I learned so much. I learned a lot. And it's a new turning point. And I think in everyone's academic career. We went from like a level of like spending like 2 hours, 3 hours a day to like 5, 7 hours.
Yeah, you have room.
Just starting, huh?
If you have room.
Yeah.
Again, if we have 15 and some of my students that have a lot of smaller activities, sometimes it's a tricky negotiation space as well.
Yeah.
So that's the challenge with, at least for the AMCAS application, is you gotta really maximize on like, where am I okay to use the space, right? Because a supplementary essay, that's separate from the entire thing, so it doesn't take away from all those other areas as well. Yeah.
So we did get a question on here. In terms of amount of experiences, is it a red flag with admissions if you only have, let's say, 9 or 10? I can
No.
answer that. Okay, you can answer that.
Sorry, no, no. Yes, it would be helpful to have a variety, but it's going to be more important to say, okay, that's fine if you have 9 or 10, we see that all the time. I'm more curious then, how much time have we spent on our meaningful? Right? Because if I have a student that like started research in their second year because that was something they're really interested in, and lo and behold, we find out that's something that they're really important to them, that needs a lot of time, right? Like that could be 20 hours a week over 2 years. That's an insane amount of hours. And so we look at it from both the combination of experiences, the depth of the experiences, and what we're actually saying. So just because we have a smaller amount of experiences doesn't mean the quality isn't there, right? Quality is its own category of assessment based off of what we can articulate. Yeah. And then, so real quick, letters of evaluation, we are going to be submitting them. Minimum is 3, maximum is 10 for the AMCAS application. When you're filling it out, you are adding the entries for all of your recommenders. And then once we get to submission, we will be assigning those letters appropriately to the schools. I say that because every school has a different policy on how many letters they're willing to read, right? Some schools are 5, some are 4. some are 6, some of them don't put a limit, but your limit is 10, right? So that the answer is going to be, it depends on your school list. But keeping that in mind, even though you're filling it out, once you submit your application, that notification is going to go to your letter writers to upload. And so you want to be very mindful of following up with your letter writers as you submit it. Now, there are going to be some interesting interactions that we can touch base on. So like for example, on AMCAS, they accept 3 different letter types: individual, committee, and packet. I will say this right now, committee and letter packet are typically for specialized programs somebody's enrolled in. So say I'm part of a post-bac program that has a letter packet or a committee letter, they're going to expect that letter from that post-bac program because that's what they are known for, right? I do know sometimes it's up for debate with committee letters because it might come from a school where they limit how many students they're allowing to apply for medical school. So at UCSD, we don't do that. We recommend students get all individual letters. But if you are a participant in a program that requires a letter packet, then you submit it. All right, besides that, like I mentioned, minimum 3. Most of our students target about 4 to 6, max is 10. Letters can come from anywhere. I always like to say the easy shortcut to understanding letters is it is a reflection of your academics and your works and activities. And ideally, a good chunk of that is also coming from your meaningful experiences, like Jade had mentioned before. All right, so when we're submitting, what are the ways? Mail, which is the slowest, AMCAS directly. So when you fill it out on the AMCAS, they'll ask them to upload it. The third option or the other option is Interfolio. I will say Interfolio, you have to pay for it. I don't know how much it is yearly, but it is a yearly fee. And with Interfolio, the idea is if you have a letter writer who wants to submit right away, and you're not ready to apply or you don't have them ready to go, they can upload it to Interfolio. Alternatively, if you feel like you're going to need the letter for other circumstances or you need to hold it over a year, Interfolio will hold on to the letter for over a year, right? They'll hold on to it for as long as you are willing to pay. So that's why we mentioned Interfolio. And then we always get the question, when should my letters come in? As soon as possible. And that's really because from an admissions perspective, yes, you can actually get to things like secondaries before your letters are in, but we don't want the letters to be the reason why your application doesn't advance in review, right? Because I've known some schools where they will say, you are missing one of your letters that you have listed that is getting assigned to us. We are going to wait on the review until that letter is in, right? So if that letter isn't coming in, take it off, update your application to take it out. Yeah.
When would you recommend we send the request to people or like committees or not to send in the letters?
Like when does this go out? It goes out right when you submit.
Okay.
Yeah, so your letter writers should get a notification. If you've already collected through Interfolio, then around the same time you've asked Interfolio to forward the letters to AMCAS.
I know, I meant when would be the earliest or like the earliest time we can send the requests like through AMCAS?
Yeah, when you submit basically,
Okay.
yeah. So that's why I say it's like as soon as we submit, we want to send a message to all our letter writers so that they know to keep an eye out for the ID, the upload instructions, and then also get a confirmation that they're actually uploading it, because that can help you gauge how well it's moving through the application process. And then the other thing I get is about letters and dates. Ideally, the letters coming in with the most current date possible, just because that gives us a little bit more of a recency timeline, right? Like as a reviewer, if I see a letter that's over 3 years old, I might question, is this still reflective of the current person I'm reviewing? Right? Because as a reviewer, I want to know, does this reflect the applicant? All right. So some basic steps here. I'm just trying to remember if there's anything up here that stands out. So this is basically just a quick walkthrough. All these steps are also available online on the AMCAS application guide, as well as on their FAQs. Yeah, so then we've covered all that. That's fine. And then Interfolio, just some quick reminders. Once you create your account, you'll need to subscribe. So creating it is free, but using it is paid, right? And then basically with those, the biggest thing I would think about is. Only use it if you really feel like you need to use it, right? Because you do have to pay for it. And it's an additional step of getting additional submissions over to AMCAS. So it's just one more thing you're juggling on the process. And then if we have any questions on Interfolio, I always say please review their step-by-step instructions. AMCAS and Interfolio both list instructions for each other. So just a quick heads up, this is a sample of how somebody might be assigning their letters. So interesting enough, they had quite a few letters, 1, 2, 3, 4, 5, 6, 7. So that's pretty generous amount of letters. With these though, you'll notice for one school, only one school, they had assigned maybe that specific letter from Dr. Douglas. So it might mean that either that was the only school that accepted more than 6. Or it might be that that particular school has a specific type of letter that they put as a preferred that is called out for that reason. So when people ask why does letters have to be assigned, again, there could be a limit of how many letters a school is willing to read, so choose wisely, right? Even if you have a ton of letters, they might only read 4. And then the other thing to think about is if the school lists what their preferences are. Right, so they'll say, we would like to see a letter from a direct supervisor. We would like to see letters generally from this list of types. So just keep that in mind for as you assign them out to your letter writer. Going into personal statement. I usually say this is kind of the linchpin of your narrative. So it's like one of the most critical parts. Hopefully you guys are already pretty close to getting done with personal statement. But I do want to just kind of do a quick recap of things before we submit. It's important we account for all these things. So character count is important, right? 5,300 characters. It should be a reflection of your growth, motivation, and fit for the profession, right? Sometimes I could have a very interesting personal statement, but end it with, I have no clue if they actually want to do medicine. We probably did not follow the format in a way that would be helpful. And then we always say avoid restating your resume or just your works and activities. There should be a duplication of information, right? We have limited space on the application. So hopefully when I'm reading your personal statement, it gives me a unique understanding of your journey to healthcare. And your works and activities further verifies what are the professional things or things that I have done that affect my lens, right? The lens in which I understand and interact as a professional. Right, so they are two different things that can be related because, again, they are related, but personal statement, it has the ability to focus on things that exist outside of your works and activities, right? Like I might not put, I was a caretaker for my grandparent for 5 years on my works and activities sometimes. But I might put that in my personal statement because that could have been a time of when I was in high school, right? And so personal statement has a lot more flexibility because it's really about our experience going through life really and making those decisions towards healthcare. So hopefully we've brainstormed already key moments that we're going to talk about. Yes, Steve.
Can you please talk about the section that is kind of like the added personal statement? I think the term for it is called optional essay. You want to talk about that real quick? Because some people will ask like, oh, what should I put on the optional essay?
So again, optional essay is usually for information that isn't going to be on the personal statement or anywhere else that exists on the essay. Some schools might even make recommendations on the optional essay. So like for example, if a school that is really interested in staying staunchly talking about resilience, equity, diversity, inclusion, maybe there's an additional component that's not part of your about your personal statement that also includes kind of a background of how you connect to a specific community. I would argue most of the time your personal statement will do what it needs to do to talk about yourself. And that additional space is really for if there's things that don't fit in anywhere else, that is kind of our extra space where we can either address challenges, talk about additional background context that might be useful or beneficial for understanding who we are. But since it's optional, we always want to assume we're putting our best foot forward with everything else on the application, and the optional area is a space to kind of provide extra context that might not have room to be covered.
So some examples, just to make it a little bit more tangible, would be like GPA dips or maybe like gap years that you've taken that you might want to explain. Not all gap years are bad, especially if you're, if you're being productive during that time. One thing I will say that I've seen that I didn't like was talking about something that wasn't really relevant. They were talking about like something going on with like extended family members where it wasn't really tied into their application at all. And I was like, actually, this isn't good to put on there because it's revealing information about like your extended family that is really deep, but it doesn't actually help your application. Right, so just use discretion when you're adding things to that additional optional essay field.
Right. Another example I would say is, I had a student who took 2 years off to have a baby, have a family.
It's amazing.
And then they came back and then they killed it in academics, and so they said, we will see a literal 2-year gap because I was raising a child and then getting my life in order so I can continue my education after having a child. Right, valid point on an essay that might be different than why medicine, right? Yeah.
And the last thing I'll say about this, because we're not going to touch on it, is the autobiographical statement, specifically that UCSD uses. The personal statement is a little bit more general. The autobiographical statement is what I think personal statement should actually be personally, because it talks about your values, your vision, and your goals in the context of your past, your present, and your future. So autobiography is like your past and your present, and to some extent, like your future goals, right? And so you have a little bit more space to talk about who you are, like your family, your culture, and things like that in the autobiographical statement. Here at UCSD and other schools do that too, but the personal statement is a little bit more general, and you have to just make sure it's as concise as possible.
Right, this is the statement that goes to every medical school.
Yeah.
Right, so it should capture who you are and why are you doing medicine. Well, all the things you could commit to, why medicine, and what's the personal reasoning behind that. Right, that's kind of universal for both MD and DO actually, and that little side note for personal statement. We get this question sometimes, is there a difference between DO and MD for personal statement? I would argue no, because at the end of the day, you're a doctor. However, when we get to secondaries, which I'll touch on very briefly, secondaries are now where we see the why DO question come up for students who do apply for DO. All right, so some things to think about. So ideally, there is kind of a mission statement or guiding thesis-like statement in your personal statement. I like to think of it as towards the beginning, a way to make sure you are communicating, mission value fit. Mission value fit, always mission value fit is part of that. And so, that we give an example, I'm not sure if anybody wants to read it. Actually, can I get a volunteer? It's really easy. Yes.
As a future physician, my mission is to provide compassionate, evidence-based care that empowers patients to make informed decisions about their health. I'm committed to lifelong learning, upholding integrity, and advocating for equitable access to healthcare, particularly for underserved communities.
Thank you. So with this one, it's very specific, but it's nice because as a way to kind of frame what is this whole personal statement about, it gives a very clear context. And I want to argue having something like this at the very end of your personal statement could really bring everything together, especially if we introduce these elements at the beginning and then close with it again. We kind of go full circle of understanding this person's journey, right? We start off a personal statement. Actually, do I go over format a little bit? Yeah, I'll go over the narrative. And so we start with mission statement and then we think, okay, are there narrative archetypes that we think about? So this is actually taken from an example at UCSD School of Medicine, where they provide 3 main kind of archetypes that they see. These aren't the only ones, but it is a good way to think about personal statement narrative, right? And so some things they talk about are the servant leader type. So people who are actually looking at where can I make change, right? Then we have the compassionate healer type, right? Are the things I'm talking about really focusing on how do I alleviate pain? How do I get to really understand my patients very deeply to heal them very holistically, right? And then the innovator type, so my curious, inquisitive, how do I make the system better, right? Whether it's research or innovation or thinking differently, like these are different kind of archetypes that come up a lot of times in personal statements. And then we also say that sometimes you'll have crossovers, right? You could be a very compassionate person who figures out a different way to help somebody, right? So you're a little bit of a healer and an innovator. Or you can be somebody who's really interested in applying social change to address barriers for patients to receive adequate healthcare from a place of compassion and understanding, right? And so again, these are just different ways to think about how do I want to see myself as a healthcare professional pursuing being a physician, and how do I communicate that on personal statements? So we give this as an example to kind of help walk you through some different ways this comes up for people in their personal statement. Again, these aren't the only ones, but these are great ways of thinking very broadly of how do I want to present what's the most important things that I have about what I want to do, where I want to go with the profession. So we've locked out everything because we're not gonna give you a personal statement, but just to give you an idea, it does take up quite a bit of space on the application, right? You know, so it's just a visual impact here of how big, how much space it takes up. But when you fill it out, it's really straightforward. There's no frills. So if you have any complicated formatting on a Word document, it's not going to carry over. So just focus on word count, clarity, if you use enter or not to break it up. But everything else will just be a straight up block of text. So also keep that in mind about the format when you're entering it. So I get this question a lot. Okay, how am I going to go about my school list? Hopefully you've already had a good idea of where you're going and how you're going to select it. I'm going to just go over some brief additional considerations for medical school list, just because I think it's helpful. So one of the things I always say is always double check the AMCAS to get really good published information about the schools. If you can either team up with a buddy or pay for it yourself, the paid account will give you more useful information in my opinion. So it'll give you like 10th, 25th, 75th, 90th percentile for MCAT and GPA. I actually prefer looking at the full range because it lets me know the behavior of a cohort, right? Versus a narrow band of information. It gives me the full breakdown. The other thing I look at is if it's a private or good correction, if it's an out-of-state school, it'll tell you, do they accept California students? Very helpful, right? So utilize that information to help kind of reduce things. I always say, really with school lists, as long as we feel we're okay with the metrics portion of it, it really boils down to where can I see myself going? What makes sense for me, right? Can I possibly go there? Am I okay with the healthcare policies in that state? That's a big one for a lot of my students right now. If I ended up practicing in that state, do I feel like that would still be a good fit or a good fit enough? Right? Other things that I would really consider sometimes, tuition, cost of living, overall likeliness that I'm going to be happy staying there for a while, right? Because it's not going to be just 4 years. It could be 7 if we decide to do residency there at minimum, 10 if we subspecialize, right? So we are going to spend a lot of time there and we want to make sure we're making a good choice.
So really quick, we got a question,
Yeah.
going back to the personal statements. Someone said, in my application, should I mention anywhere that I want to be a pediatrician or like in any specialty, right? Or just straight answer biomedicine, because that's more of a broader question. And I was starting to type, but I think it could be helpful for everyone to hear, because I know some of you may have specialties that you're interested in. I think it depends on how you're actually writing your personal statement. You can mention it or talk about it, but if you talk about it, have information and experiences to back it up. Don't just say, I would be a pediatrician. Make sure, I think the biggest thing, because you have, I know it looks like a lot, but when you actually start writing, it's very limited space. It's very concentrated amount of words that you have to like say anything about your entire life. So I would say if you mention your specialty, really that should kind of fit into, always go back to like, is that kind of mentioned in some way, shape or form in your values, your vision, and your goal statement or your mission statement? Like, does your mission statement point to that? Or do you feel like you're just kind of like throwing it on the application, like, oh, by the way, I would like to specialize in this.
Right.
Like, don't just throw it on there.
Right.
Be intentional.
So I'll give an example. I had a student that was questioning whether or not to mention that they were interested in family medicine or pediatrics. And the main reason that they wanted to mention it is because throughout their entire personal statement, and this is where it made sense. Is that it was always about connecting with the families and the people over a period of time, right? They were a summer camp tutor for 4 years straight. They were part of a nonprofit for 3 years, and so they got to develop all these relationships. And so they wanted to be as part of a practice where they knew they were going to be able to see the same people over an extended period of time.
What was their specialty?
They were looking at either pediatrics or family practice.
Could be, and so they had whole themes around.
Right, exactly, the whole theme was based around, I want to be able to work on people's healthcare through their life.
And to add to that, so our medical student who was just in our class yesterday, here at UCSD. He did a lot of work with different communities, a lot of mental health, type of work, the crisis hotline type of work. And so, I mean, I'm definitely giving like a brief overview, but he had a lot of different things that he was talking about. And then he did mention psychiatry, right? And it wasn't like the focus was, I care about people, I'm very empathetic, I care about mental health, all the things. And then, this person added, their specialty would possibly be psychiatry.
So it makes sense because we can understand that it's a component of their motivation rather than something that they're just interested in.
And then, sorry, another question, is it okay if you don't mention your specialty?
Yeah, absolutely fine, right? You can have a very concerted interest in helping people, but a lot of people in admissions will say, yes, it's great to have that interest, but no, it could change,
Yeah.
right? You could be doing 2 years of clinical rotation and realize, actually, this is my jam.
It usually does change, by the way.
Yeah, like I had a friend, he's in his second year of residency, he had an option to go into cardiology, but he realized his heart is in internal medicine. Because he wanted to be able to have more opportunities to help a wider range of people. So just to give you an idea, that was, I knew this person for over, 15 years. And but the whole time they were saying cardiology, they hit residency and they're like, yeah, no.
Yeah, I had a friend who wanted to do neurosurgery, ended up doing anesthesiology.
Yeah, exactly, like you can switch because you
Way better.
realize the lifestyle and the people and the group that you work with once you're there. So we always say no pressure if you don't know, because you'll get there, right? So some things to think about with school selection, I mentioned some of these, like looking at ranges like 25th to 75th. I would argue 25th, 75th as like middle range, 10th to 90th didn't know if like what is the full size of a cohort or a range of a cohort. I also say sometimes it's good to know cohort size because, for example, we have a lot of opinions if it's only 60 students versus 120, right? Like a percentage makes a difference when there's only 60, right? If like I'm working with a student who is applying to a state school and that state school says that they accept 10% out of state, that sounds okay. But if they only have 60 students, that's really small and maybe not worth the effort like they would with maybe some other schools, right? So paying attention to cohort size can also give us an idea, is it worth it for us to apply in some circumstances? I always say when we are doing our school list, we should also make a note of mission, culture, programs, what they are known for, social media presence, publications or articles that they publish very widely. Because this is a tip, it'll give us information to utilize for both our secondaries and interviews when we get there, right? Knowing our list very well means that we are better prepared for secondaries as they come up, or secondary essay, I should say. Some additional factors I would consider, private versus public, I would say private will have automatic listed for secondaries. That means you're going to need to do those essays right away, right? The moment you get verified, all the schools that say automatic will ask you to fill out their secondary essays. So that might be a very fast ramp for secondary essay. I always assess cost. Again, we've gone over a lot of this, which is, is this a place I am willing to put the money and time into so that I can go through the whole application process with them? Super important. The other thing is, we're paying for every single one of these schools, not only for primary application, but for secondary application. So I would argue if we're not going to do the secondary, we shouldn't be putting them on our primary, right? So we have to be mindful of kind of the cost and planning and timing that comes into play when we're putting our school list together. I'll say right now, I had a student tell me they applied to 45 schools. The first thing I said is, I bet you didn't get through all of your secondaries, and that I was right. They got through only about
How many
28,
schools?
45.
Yeah.
I fell out of my chair, like literally fell out of my chair. And I said, I bet you didn't get in to, or you didn't apply, or you didn't move forward with a lot of those schools. And they said, yeah, I could only get through about 28 secondaries. Or 28 schools secondaries. And of those schools, I would say half of them were really late on submission. Right, they were just too overwhelmed with the requests that were coming in for secondaries. So we have to be very mindful of our school list, because just because we put a lot does not make our lives easier to get in. It actually can make it very difficult for people to prioritize and be very strategic and thoughtful about what they are submitting. So I have to mention that. Also, it's really expensive if you do that, right? That's a lot of money that you're not really getting value out of at that point. And so this is what it looks like when somebody fills it out. I think this one is just at about 20 schools as an example. And then an interesting thing, this is somebody who went to school in California, so you'll notice they put a ton in California because they're like, I want to stay potentially. And then they decided to pick schools where either they felt really strongly about their metrics. They thought also, since they had pretty strong metrics, it doesn't hurt to double check and try and apply to maybe some of the more Ivy League schools. Fun fact, at the end of the day, they got into what, 18 schools?
They got, yeah, about that.
They got into 18 schools and still decided UCSD because we're awesome. Anyways. I just wanted to say.
What was the advice that the student gave?
The advice that they gave about their school list and finally deciding was, where would I wanna be on my worst day? And he said, he brought it down to 2 schools. One in the Bay Area, one in San Diego,
Oh, yes.
UCSF. They got into UCSF and UCSD, and then they said, at the end of the day, where do I want to be on my worst day? Where do I feel like I can recharge? Where do I feel like I'm going to have a little bit of quality of life outside of academics? Right? Which I thought was really
Very wise.
reflective and super smart in that, like, when things are terrible, is it still okay, right? I think that's a very kind of, again, mental health professional, or potential future mental health professional, they want to also think about their own mental health while they're going through their program. So I thought that was very introspective and thoughtful about once they finally decided based off of their school list. So real quickly, I'm just going to go over some things that also show up, standardized tests. So we all know about the AMCAS, we understand the timing, we understand the scores. I always want to make sure to mention, we usually, with situational judgment tests, schools will usually allow you to take those while you are in the application, but their deadlines for when's the latest that they will take your situational judgment test may vary. Right, one school will have it in October, another maybe September, so we just want to be mindful we're working that into our plan. I would argue, since this is closer to a personality test, we should be spending a huge amount of time studying for it. And really be more familiar with the question type and how you want to navigate those. Because really, situation judgment tests don't necessarily have a right answer, they just have walk us through your logic, right?
Materials for them?
They are, it's like about 2 to 4 hours worth from AMCAS for preview.
Yeah.
Yeah,
Yeah,
I think we're doing that.
review, I think much more than Casper is graded, like there's correct answers and you wanna get the correct answer. It's a little weird.
it's not that it's more like logic processing. Preview is a little bit, preview, I will say this, preview is newer. So preview is still, they're doing more grading to kind of understand behavior of the test. So for a lot of the schools that use preview, they're not utilizing it as a, if you get this score, you're not in or out. It's if you do the test and we can understand you better as an applicant, we might give you a little bit of a bump for thank you for the extra time that you've done to do the thing we're hoping to gather more information and understand our cohort about. So I will say preview is still being tested as far as how they want to navigate the usage of it.
I do believe that question, is it mandatory, are any of those mandatory here? So Casper is not.
AMCAS is the only mandatory thing for UCSD. I will say Davis is one of the first schools to pilot preview. And I can't remember which school, I think there's like 1 or 2. that I've had students apply to before that use Casper. Yeah, so again, don't do it unless you know for sure on your school list, they say that it's required. Or that you feel based off the schools that you're interested in, if it's recommended, it might be something you want to consider. But it's usually not a hard line requirement for a majority of programs out there. Yeah. And then some other recommendations or considerations for test scores in general and testing. MCAT, they will see everything, so just be prepared. And I say that because I had a student once, they took it 3 times, once 4 years ago, then 2 years ago, and then a year ago, they will see all 3 scores. That doesn't mean that they are going to judge you partially for multiple retakes necessarily, but it does inform them of your highs and lows and your ability to perform on the test, right? And so depending on how the school wants to navigate that, they have different ways of kind of trying to interpret what that behavior means, okay? The other thing, I will say, with situational judgment exams, you can't take it during the application. It would be nice if you just didn't, and you just did it earlier. So it might be too late now, but I always like to mention that just because. The less things we have to put on our plate while we're applying, the more we can focus on the application. So I always just like to mention that in general when it comes to tests. And then always double check submission deadlines and hard cutoffs by institution. So real quickly, this is how it kind of looks when you're inputting it. This is a sample of a student who took the AMCAT and preview. So preview is out of 9 points. 7 is still high at the 90th percentile for preview. And so basically high on the executing judgment score. And then for MCAT, this particular student did very well. So on MCAT, we always see the main score, but we also see the confidence band. And so with the confidence band is just to acknowledge that this test has multiple versions, and depending on the version of the test, you could have landed anywhere between 517 to 521 overall with how these tests go. So sometimes the student will say, do I have to retake it? Well, if you feel like you might have had a version that didn't align as much with you, but the confidence band is still reflective of a lot of the schools you want to get into, maybe you don't want to retake it, right? Because there is that confidence band, and we do talk about the confidence band in admissions a lot of times of, how do we feel about that? So those are just some areas that I wanted to mention real quickly. Also, depending on the school, they do look at the individuals if they have preferences on things that they want to know. When I work with a few different deans, sometimes they look at it to know with the cohort that they've accepted, where they're going to need to spend the most time doing any additional tutoring or review for the cohort, right? If we notice everybody in this cohort this year did slightly worse in CARS than we thought, maybe we need to spend additional time walking them through some critical thinking and analytical skills that CARS requires, or maybe have additional tutoring on that. So it's not always just for purposes of admissions metrics, but it's also for decision-making factors for that cohort moving into their academics, which I always thought was a very interesting thing that most people don't know about. All right. So submission and certification, make sure but when you submit, it's kind of final. I have to say that there's like no takebacks. So the only things you can change is add schools, update tests, and that's about it, right? You can add additional schools to your list and you can update test scores and letters of rec. Because those are the things that can kind of hang out. Everything else is locked in at that point. So we want to be very mindful of that. Because I had a student say, well, I have a class in progress and I happen to get the grade a month later, can I submit the transcript? You will have to go through your own application process to the AAMC to justify why they need to go back and update your records. Right, so you could try, but it is I would not be in the mindset to want to deal with that while doing everything we just mentioned on application, so just be aware of that. And then I'll touch on this, secondaries are basically the next step. We're not going, this is primarily application overview, so we're not going to hit too much on secondaries. We do a lot of appointments on the secondaries. I will say some major considerations. For all the schools that we select private, yes, you're going to get your secondaries right away after verification. For our schools that are public institutions, typically it's not automatic. And so we can expect anywhere from a couple days to a couple weeks for them to filter and go through some initial review before asking for a secondary. I always say you want to be very realistic about what you can complete. And so you have to choose wisely which schools you want to prioritize, getting those in as soon as possible, right? A school will assume if we are a priority, we will submit our secondaries within 2 weeks, right? 1 to 2 weeks ideally.
Yeah,
And then everybody else, get them in as best as you can.
and I have seen students, actually one of my students who got, actually, so the student I told you that got into UCI, they had a great financial package, but they ended up getting a full ride to UCLA for the Future Leader Scholarship, which was like crazy. I was like, I couldn't believe it, full ride. But anyways, they ended up not filling out half of their secondaries because life happens. So they ended up having to decide like, okay, they ended up not submitting the UCSD one for various reasons and a few other ones. And so they basically stopped their application right there. Cause it's a lot, like prepare for life, because life will happen.
Right, so we have to make really critical choices right
Yeah.
with secondaries. Right, because anything we don't move forward with here, we're just not moving forward with. Alright, so some quick final tips before general Q&A. It's really a review, so make sure that you are ready. And then remember, we define competitive not by metrics, but by really comprehensively thinking. You know, is this a well executed application where we understand our narrative, our theme, our values, our fit? As Jade mentioned, can we see your soul in the application, right? Like you are a real human being with real motivations and reasons why this makes sense. Try to get everything in earlier the better because it's rolling admissions and we know that timeline is a little bit unforgiving, right? I always say, you know, avoid delays. But also don't rush through it at the risk of either providing poor quality or inaccurate information, right? So we always want to be mindful about that. I would say once you can start your secondaries, get to them as soon as possible. You can continue to gain experience while you're in application. I always say it doesn't hurt. Just know that that's not necessarily something we look at in admissions right out the gate, right? Most of the time, if it is going to come up, it's going to come up way after the fact. But we would still encourage people to continue developing their experiences because that just makes them stronger before getting into the profession, right? And then for us as healthy and healthcare advisors, when you're filling it out, there's a little option to release application to your school. Please do that. We use that information to figure out how you guys are doing. And so that if there's anything we need to adjust, change, support for future cohorts, we can be very thoughtful about, okay, where do we see our students getting in? Where do we, what kind of additional information we can kind of glean? How can I leverage my knowledge of admissions to give you guys pro tips, right? Like these are things that if you release that information to your home institution, it helps us figure out how, how people are doing better year after year, okay? So those are kind of some big final tips. And then we can go into Q&A. Or general questions if you have additional questions, same for people in chat.
Yeah.
How are we doing?
So we just got, I would be applying to the 2026 cohort, yes. So if you apply now, or when at the end of the month, you submit your application, say. It would go back, do you wanna go back to that timeline
Yeah.
real quick from the beginning?
Oh, Mike would be better here, because that's like.
Already at the beginning, because I think some folks joined late, which is totally fine.
Yeah,
So if you look at the timeline, you'll see submission. And then it takes literally a whole year. So say this is 2025 right now.
yeah. Oh, sorry, yeah, we're good.
Yeah. If it's 2025 right now, then July through September would be 2026, so you'd be the 2026 cohort if you apply and get in.
Other questions?
I think I'm gonna download these and share it in the chat.
Are there schools with early admissions, early submission to the, or this AMCAS application, it opens on the 27th.
So submission is submission for everyone for AMCAS, right? There are early acceptance programs for a very select number of schools. The pro and con of that is if you get accepted to an early acceptance program, you will not know your results for any other school. Right, so as far as early anything, that's the only one off the top of my head that where it really makes a difference. Usually they'll say you need to submit your application by a certain time for early consideration. And that will be on the admissions, but as far as in general for the AMCAS application, once the 27th hits for this year, actually is the 27th. Once that's hit, it's go time. The sooner you submit it, the sooner it goes through the rest of the process. Yeah. Again, 2 weeks if we're lucky and it goes by quickly and smoothly and transcripts are a joy, which is not always the case. Otherwise it's anywhere to 4 to 6 weeks for a lot of other students, right? I used to work with scheduling and I used to hound instructors all the time to post the grade so that we can submit the transcript.
And then we got a question, if you submit after August, you still have a chance.
Statistically,
That application.
Statistically, your chances go down the longer you take. If you have a very solid application, you can still have a chance. My concern is because of all the other things that land. Like just submitting it that late is potentially fine, but then my next concern is when are they going to read your secondaries? Right, because I have to read the secondaries. Put that in the pile and then figure out, is this going to be must interview, recommend or must interview, recommend interview, do not interview, right? Like that is the next step on the review process. And so if we're just getting the application submitted August, I might not be seeing that student get their secondaries in until September. Which means it might not get on my desk for review until October. And that's maybe for scheduling dates for interview in January or February. Right, so it's not that it's not possible, it could still be a very solid applicant, it could still happen. But you get it's kind of a rate of diminishing returns on how much space and bandwidth admissions has to get through your application. Yeah. So I know a student who squeaked by and got in, but he was my unicorn that year. As far as getting all the paperwork in. He got all his paperwork in, he was relatively fast on his secondaries, but his initial submission was August. And the whole time it was nail biting because we were just hoping that they would get through enough interviews by the time interview season closed.
So this is a big question because a couple of students that I've worked with kind of have this situation. I'll read it verbatim. If I submit my primary as early as May 28th, but take my MCAT in August, would this affect me?
Potentially.
Would you like to expand?
Yes, this is where nuance and it depends is really critical.
So true.
Right, because some schools will not start your application review if they know you have a pending document. Right, I just know, I've talked to several of them, some of them will say, for our institution, if you don't have everything in, we're not reviewing you because it's a waste of our time.
Yeah.
Right, whether it's MCAT or letters of recommendation, if we are missing a part of your application is not done. And they stand close to that because if I have 9,000 applications, 10,000 applications, I'm going to prioritize the ones I can fully review, right? Some schools are like that.
Yeah.
Other schools might be a little bit more forgiving, but that's not all schools, right? And again, Jade and I have to work towards understanding by and large what we have to work with almost 160 medical schools. So just because it's okay for some does not mean it's going to be okay for every school on your list. And it can be detrimental for several schools, right?
It can, yeah. Okay, I was gonna add something regarding like applying, oh,
It's also stressful.
yeah, that part. So one thing I was gonna say is if you submit in May and you wait till, say, August to take your MCAT, I generally am advising you as a student to wait till the next cycle. If you remember, and this is from my folks in the chat who asked this question, if you remember in one of the slides in final tips, what is it, if something don't like react or something? What's your terminology?
Oh.
Go back to the slide.
So fun fact, I love puns and.
I don't know you said that, because it's kind of catchy.
So this is something I know you talk to in the post-bac programs. Take a gap, don't be a react.
Yeah. If you're not ready, and so the reason we say that is because if you reapply, your chances actually go down a little bit. For some schools, that you've already applied to, because if you didn't improve enough, then they're gonna see that as a detriment to you. And so when Ron and I give you advice, we really try to give the best advice possible. Well, like I tell my students, you're gonna do whatever's best for you. Right? So for my folks in the chat that are wanting to take their MCAT in August, I do not recommend you apply this
Yeah.
cycle. However, you can do it, just know that you might need to reapply, right? Because I know everyone's life is different and they don't want to wait, and I do understand that. You might have to reapply, and we would need to talk at that point about how you're going to better your application. If and possibly when you do reapply in the 2026-2027 cycle. I'm not saying it's impossible, I'm just saying, like, like, we have a lot of information, we try to like look at everything in context. And I still don't recommend it, so yeah, hopefully that answers your question.
I will say, I've had 2 people I've worked in the last couple of years. Where they did take their MCAT very late in the process. They did well on their MCAT, but because, and studying for MCAT like takes 3 to 4 months of studying 15 to 20 hours a week at a minimum, right? So we're clocking 4 to 5 days at 4 hours a day at a minimum. While working on our application, right? Because if we're doing the application while we're doing the MCAT, we're dividing our time. Your application can suffer very quickly from not being able to execute all those important things in a timely manner well, right? And so for my students that did that, their biggest challenge was they were okay with their MCAT score, but the rest of their application was rushed. And so I could tell very quickly they didn't do a great job of their primary application and their secondary, and they ended up not interviewing. Even though they got all the information in time. And so that was very recently, these last couple of years, so in general, I would rather avoid having people to redo things because of either rushed. It's just a lot of money, it just kills me, you know, I want people to be successful, right? Like, you know, we wanna make sure that you're taking the time necessary to do it well.
Another question, yeah. How would I know if I got accepted for the secondary application? From what I understand, there's a list that is on these slides that I'll see if I can find. But some schools automatically send you secondaries and some schools do not automatically send you
Correct.
secondaries. A lot of public schools, right there, yeah. So I'll see if I can get that in the chat, but a lot of schools will not send the secondary and you won't hear anything from them. They'll kind of ghost you, unfortunately. So just assume that if you don't get a secondary within a few weeks, that they're not sending you the secondary.
I would say, for example. Say I did all the things, I got my application in before at least July, right? Knowing interview season happens in September onward. If say I submitted in the summer and I haven't heard for secondaries.
Yeah.
Before the end of fall, we are probably not gonna get contacted, right? Because they've already moved forward with interview. So I always look at what's the next part of the process. And if we start to really overlap with that next part of the process, chances are we're not moving forward and admissions just hasn't had the bandwidth to send any additional notifications.
And then just another clarifying question, it's kind of long, so bear with me. When you said that some schools will not review your application at all if there are pending documents such as
Yes.
letter of recommendations, etc., is this referring to primaries or secondaries? That's the first question. Do I need to have my letters of rec in when I submit my primary? If I don't have letters of rec yet, is it better to wait to submit my primary? And I can answer this.
Well, I'll let you go.
Yeah, because it's a lot. So, is this referring to primaries or secondaries? We are referring to your primaries. Okay, when we say that some schools will not review your application, we're referring to your primaries, which includes your MCAS score, which some of you are asking. Do you need to have your letters of rec? Primarily, I would say you would need your letters of rec by the time your secondaries come back. So you can wait after you submit your primaries to submit your letters of recommendation, but I wouldn't wait too much longer. Than like say like by the time you get your secondaries back.
Right, and keep in mind, and this is a very critical thing, you're not submitting them, your recommender is submitting them. Right, so that means if you have a old school faculty member who doesn't know how to upload things, you're going to factor that into your plan for reaching out to them to make sure it gets done. Because I've seen a lot of times where people don't follow up. And they could have had everything in a timely manner, but they just could not connect with their letter writers to upload the letters.
And then also, if I don't have letters, is it better to wait? So I would say you do need to enter the
Minimum
letter
three.
writers in the system. So submit with your letter writers in the system and hopefully they get the letter submitted on their end by, let's say, July. Say if you submit May 28th, hopefully they get their letters in by July, which is when your secondaries are due. Hopefully that makes sense. So that's kind of a month lag.
Right,
So that is a little bit different than your MCAS school.
Right.
So let's, maybe you can help clarify too.
Mhm.
So, cause I know a lot of people are kind of splitting hairs, which I understand because this is, you know, what they're doing this cycle. So say they take their MCAT in August,
Mhm.
how is that different than submitting your application in May?
Mhm.
And waiting for your letters of recommendation in say July versus submitting your application in May and waiting for your MCAT in August?
Okay.
How's that different?
Process. So, in general, from an admissions perspective, if you have almost everything, you should be going through the process to get to the next step. Because for private institutions, remember, they're not reviewing your application until secondaries are in.
Yeah.
So from the private school perspective, submitting it earlier is preferred, period. From the public school institution, depending on what their policy on filtering is, that's where it gets tricky and that there's nuance, right? Because some schools can say, we're not going to even do an initial secondary review unless all these things are in. Others might give a flexibility clause of like, we're allowed by this time to start reviewing. Other times you'll get to secondaries, and if your scores aren't in, by the time your secondaries are in, they might just sit on the queue until those scores are in, right? And so the challenge is, it's not a hard and fast for every single school. The challenge is you don't get to control that.
Yeah.
Right? And so that means that it's up to each individual school to decide, is it worth it for me to bother with your application if it's not done?
So you're taking a chance essentially,
Always
you don't
take a
have your
chance.
ducks in a row.
Mhm.
I think that's like
Yeah,
the main answer, but that was really good because some schools, they send you back to secondaries automatically.
Mhm.
So with that, you can kind of lag a little bit with your impact and
but then
your
you're doing your
letters.
secondaries while studying for the MCAT.
So that's so we're kind of splitting hairs here, but I hope the folks in the chat, you kind of you recognize that you are really splitting hairs in your application and you have to like really manage your time. Cause you're doing a lot at once, and that's why, again, I'm gonna stick to what I said in the beginning, wait till next cycle. But it's still, at the end of the day, it's up to you.
Questions? Other things coming up? Things are like, I have no clue what this means. Yes.
This is more of a general one, but. For me personally, a lot of my activities lend themselves with like a public health slant. How do you make sure you don't answer the why and D with a why and H?
So this is where you wanna think about, and this is something that actually, was advice from a dean, which is you approach your communication as a future clinician. Right? So it's not just looking at the outcomes and the community, because public health has a lot in common because it is healthcare, right? Public health is understanding community, population, inherent socioeconomic challenges for that community that creates disparities or challenges within healthcare, right? There's a lot of different aspects that are very transferable. The big difference is how you make a change and affect that community, right? From a public health perspective, it's really talking about policies, programs, and implementation. From a clinician perspective, it's really talking about understanding the historical context of public health and the community. How do I want to show up as a physician who can support that with a bit of empathy, humility, and understanding, right? So it's really being able to bridge that with how do I approach this application as a future clinician and make sure my language and how I want to talk about it is from a clinician experience. Yeah. Great question though, because they're very closely tied together, right?
Oh.
And then the other thing is it could mean that one of the best things that is suited for you is community health as a medical professional. Yeah.
Really quick, for secondaries,
Yes.
UCSD selectively sends secondaries.
Yes.
So for my folks in the chat that are asking, oh, if I get my letters in, now you can kind of calculate in your mind. So they selectively send secondary, so actually, it's not even to your benefit if you wait too long to send your letters and get your MCAS scores in, specifically for UCSD, because they selectively send back their secondary, so they won't automatically send that back to you, which almost, if they did, it would buy you a little bit of time, like a month or so. But because they don't, for my folks in the chat that are wanting to apply to UCSD, but will not have their letters or their MCAS scores until later, I would wait till next year to apply to help your chances, because they are selectively sending secondaries. Meaning if they don't like your application enough, you are not getting a secondary. And if you're in the queue, they're sending secondaries, which are limited to other applicants. So I hope like that splitting hairs makes more sense, so you can kind of decide for yourself.
So for example, admissions perspective here, I would say it's generous for a public institution to send out secondaries to about 50% of their population. So 50% of the applications are getting secondaries, that would be considered generous for state school admissions, just because of the volume that they have to get through. Right, so even at that point, that's a lot they have to scrub through before secondaries.
So there's a couple questions about letter writers. So one is, will you be notified when your letter writers submit? I believe yes.
It'll show up on your application when the status updates.
Yes, and then, let's see.
They should
How-
all like,
how- Right, how do your writers know how to structure their writing if they've never written one? I put a link in the chat, but AAMC provides a guide for your letter writers. For our transcript, do we just reach out to schools asking them if they can submit our official transcripts? How are they going to know where to submit it?
AAMC has a detailed guide about transcript submission. It goes directly to the AAMC. AAMC also provides a instructed letter that you can provide to your registrar. So they are very adamant about making sure it goes to the right place.
I'll put a link in the chat for that. Just to get this confirmed, UCSD won't send out secondaries unless they have MCAT, LOL, letters of recommendations, etc. Correct.
For the most part, I mean, they might give a pass, but it's again up to admissions that year. So again, you guys are trying to do hard and fast for everything, and it doesn't work that way.
Yeah.
Right, like if admissions is in a bind, they are going to be stricter, right? But that's up to them that year if they need to do that or not, and you can't control that. Yeah, and then for my people in person, I know we're past the time, so if you do need to head out, that's okay.
Sorry, y'all.
Please feel free to grab a snack if you still need or water, and then Jade, how long do you think we,
I can be here till 1:45.
okay, so for any additional QA, we can stay on. Yeah. Anything else?
How would I go about retaking a class? If you got a D, second time you got a B. So you would enter both grades on your AAMC, like where you enter your grades in your classes, and they do their calculations on the grade that you got for the class. So in this case, it would be like a C, like for your GPA, but you at least have the minimum grade required, hopefully for the class that you, because a B is surpasses the minimum grade required, so you're fine.
Yeah.
But it is gonna affect your overall GPA.
Yeah, yes,
How do we set up an appointment with you guys?
handshake.
Yeah,
Handshake free help, I would say check Fridays after 4:30 for availability for 2 to 4 weeks out, depending on the time of year. But usually on Fridays is when appointments release and
And
then,
sometimes Mondays.
and sometimes Mondays.
Mondays.
Also, sometimes students will cancel appointments when they realize it lines up with a midterm or final, so it doesn't hurt to check more than a couple days in the week.
Do you guys happen
Typically,
to have,
Fridays and Mondays are good to check.
do either of you guys happen to have availability today after this presentation?
That's an audacious question on him. No, I don't think either of us do, but I will be releasing more appointments this Friday or Monday for 2 to 3 weeks out. So if you wanted to meet with me next week, then you can check this Friday or on Monday.
Hmm.
Yeah.
Yeah.
Is there a question that we can answer?
Yeah, it's like a 10, no, well, I wrote my personal statement
Oh, yeah, I love reading those.
and just 10 minutes. Just
Oh.
look through it, just any,
I have a little bit of 139. I can give you like quick feedback.
just 10 minutes,
Yeah.
or 5 minutes.
If you wanna come over here, I'll look at it.
That's helpful.
Thank you.
Helpful people.
Cause you're here, you took the time and you showed up, so we're gonna help you out.
Thank you.
And I do love reading.
You recommend
Make sure I'm reading.
Because currently I have like one from surgery that I tried out at CA. And one from professor that's like my mentor for
It
this
is.
type of
Okay,
thing.
here.
Do you recommend like, there's another person that was, wondering if I should ask, but she's my instructor for my MA's program that I'm in right now. She's not like particularly like in like an institution that's like really well known.
Doesn't matter.
No,
So the thing about a faculty letter, and this is where I will say title and prestige doesn't nearly mean as much. Is if I'm an educator and I'm reviewing a letter from another educator, what would I love to know about the student? How are they as a student? Are they a lifelong learner? Can they demonstrate qualities that show that they are going to be successful no matter what they do academically, right? And so sometimes I feel people focus too much on title and prestige of something. When, okay, one of the best letters I've ever read was a coach for an athletics student who knew the person for 4 years, right? Best letter I ever read because it told you about who they are as a leader, where they see them in the future, how they handle challenges, how they work well with others, like phenomenal letter from somebody who had nothing to do with academics or healthcare, right? Because those letters really should speak to what are the strongest qualities that they see in the candidate. And how, from the context that you know this person, does that show up, right? So I always say, any letter can be a good letter. Some are great letters just because of the relationship that you have, and those letters typically stand out. Yeah, so always, if you have somebody that's willing to go to bat for you and they're a professional, yes, please. It's like, you know, that's why like when I have like my mentees that I like mentor, like if they ask me for a job reference, absolutely, I will. You know, say these are the things that I think they do really well, this is where I can see them growing and expanding and what they can do. Right, like if they know a person enough to give really thoughtful feedback, I think that's where it's really helpful. Oh, by the way, did we stop recording?
Now I can talk.
Okay. Cause I think, is it over?
Yeah.
Okay. I wasn't sure if there